Welcome to the Synergen X guide on how to administer a glute injection on another person. Testosterone replacement therapy is often administered via intramuscular injections, most commonly in the gluteal muscle or buttocks. This guide will prepare you to, safely and effectively, administer an assisted injection in the glute. Let's get started. When performing any health-related activity, it is good practice to wash your hands before you begin. Wash your hands thoroughly with soap and warm water for at least 20 seconds. Now let's open your self-injection kit and prepare the materials needed to perform the injection. First, locate the pre-filled syringe. Remove the black rubber stopper at the end of the syringe. Next, you will need to remove the needle from the packaging and attach it to the syringe. Now, open the alcohol swab. Additionally, you may want to prepare a gauze pad or a cotton ball, a bandage, and lastly, a sharps container to dispose of your syringe. A sharps container can be purchased online or from a pharmacy. You can also use a hard plastic container such as a laundry detergent jug as a sharps container. Now we are ready to prep the injection site. You should have a prepped, pre-filled syringe ready to go. Let's check for air bubbles. Hold the syringe upright with the needle pointing upwards, then gently tap the barrel to bring any air bubbles to the top. Slowly push the plunger until the air bubbles are expelled and only the medication remains in the syringe. Ask the person to either lie on their stomach or stand with their weight shifted to the opposite leg. Identify the correct injection site in the upper outer quadrant of the gluteal muscle just under the hip. This area is safe for intramuscular injections, avoiding major blood vessels and nerves. Clean the area with an alcohol swab in a circular motion from the center outwards. Let the area dry before administering the injection. Let's get ready to administer the injection. Ensure the person is in a comfortable position with the muscle fully relaxed. Holding the syringe like a dart, quickly insert the needle at a 90-degree angle into the prepared gluteal site. The needle should be fully inserted into the muscle for proper delivery. Slowly depress the plunger to inject the testosterone into the muscle. Administering the medication slowly can help reduce discomfort. Once the injection is complete, swiftly withdraw the needle. Immediately apply gentle pressure to the injection site using a sterile gauze or cotton ball. Please note, never attempt to reuse a syringe or needle. Once you have completely injected the medicine, immediately dispose of the needle into a sharps disposal container. Once you have disposed of the syringe, gently massage the area to help the medication disperse and reduce soreness. If necessary, apply a bandage over the injection site. Going forward, it is a good idea to alternate injection sites every time you administer the medication to the same person. This helps to prevent bruising or the occurrence of small nodules under the skin. It is uncommon, but if the person you are giving the injection to experiences significant pain, bleeding, or signs of infection, for example, redness, swelling, warmth at the injection site, or if they experience any unusual changes to their health in the duration of their treatment, please do not hesitate to contact us. You are now fully prepared to safely and effectively administer a testosterone injection into the glute of another person. Thank you for choosing Synergen X. We look forward to seeing you at your next appointment.